My preservations are what and then sanitation and hygiene. When you finish on your certificate on biomedical sciences, we actually need to put on your transcripts all these topics. Right. By the end of this lecture, you must be able to differentiate between a disinfectant, an antiseptic, and a preservative. You must be able to explain the core principles of sanitation and hygiene in herbal medicine practice. Describe the detailed mechanisms of action for various chemical and natural agents. Identify appropriate applications and circumstances for each substance. You also should be able to give them common examples of chemicals and natural products used in these roles. What is a disinfectant? Please make sure you understand these definitions and the differences. Now, a disinfectant is an agent, usually a chemical, that destroys or irreversibly inactivates microorganisms on inanimate objects or surfaces. Remember, we are talking about inanimate objects or surfaces, not humans, right? What are these examples? Countertops, counters in my shops or pharmacy or even on your desks. Equipment, my floors, and disinfectants are generally too harsh for use on living tissue. Those women who clean the floors every morning, they come very early, earlier than you. The dishwashers, the liquids that they use to clean the floors, they actually use disinfectants to sterilize it, right? So I'm sure you now understand the definition of a disinfectant, right? Antiseptic. What is an antiseptic? It is a substance that inhibits or reduces the growth of microorganisms on living tissue. For example, your skin, your mucous membranes, to prevent infection, right? They are generally less potent than disinfectants to avoid tissue damage. That's the difference. I'm sure I made it clear here. The difference between a disinfectant and an antiseptic. An antiseptic, you actually use it on tissue, living tissue. I repeat again, it is a substance that inhibits or reduces the growth of microorganisms on living tissue, for example, skin, mucous membranes, to prevent infection, and therefore are generally less potent than disinfectants in order to avoid tissue damage. Preservative, it's a substance added to a product, such as herbal tincture, cream, food, or a beverage, to prevent or inhibit microbial growth and spoilage over time. That's a preservative. That's what we have seen earlier on. A sanitation, it is the process of creating and maintaining a clean and hygienic environment, often by reducing microbial load to safe level. It involves cleaning and disinfecting to prevent disease. Sanitation is practiced every day in hospitals. And when you finish there and you are working in a hospital, you must make sure your working place or bench is sanitized, it's clean. Otherwise, you infect patients. Washing your hands, that's the hygienic of that. Right? It's very, very important to take note of that. Hygiene. What is hygiene? Sometimes you may be unable to explain or to define hygiene. I once experienced all these issues when my grandchildren ask me from school, what is this? What is this? Then I can't explain, although I know what it is. They laugh at me. So hygiene is a set of practices performed to maintain health and prevent disease, focusing on personal cleanliness, for example, hand washing, and the cleanliness of the immediate environment. It's a practice, general practice, especially in hospital setup. The main objective of using these agents and practices in herbal medicine is to ensure, again, the safety, the quality, and efficacy of both the raw materials and the final products. This prevents patient infections, maintains product potency, and extends shelf life. Some products sold by traditional healers in town there, these bottles and the like, they are highly contaminated. Because there's no sanitation, there's no hygienic practices. Let's look at detailed content and applications of these disinfectants. How do they work? The principles involved in disinfectants. They work by targeting and disrupting core microbial structures. They are used on non-living surfaces, as I said, where their toxicity to human cells is not a concern. Where do you apply this? Cleaning your surfaces, cleaning your equipment, cleaning your utensils in the preparation of herbal products. For example, chemicals and examples of chemicals and mechanisms. Now we are going to look at these examples. We have already looked at them, so we are not going to talk a lot about them. Alcohols, the isopropyl alcohol, the ethanol. Like again, we have looked at the mechanisms of action of alcohols. Chlorine, we didn't talk about chlorine. Chlorine compounds like sodium hypochlorite, the bleach. I'm sure if you are living in some of these high density areas like Micheke, Kunana range, when you open your tap, especially in the morning, you actually see this comes with water. It's cloudy. It's because of chlorine that they use. And mainly it's sodium hypochlorite, which is a bleach mechanisms. These are strong oxidizing agents. They destroy microbial proteins by disrupting cell membrane and essential enzyme systems through oxidation. Jik, this is jik. Jik is widely used in toiletries in almost all the houses, right? This is a disinfectant. Natural disinfectants, tea tree oil. What is the mechanism of this tea tree oil? And remember, the chemical constituents of a tea tree oil is called terpene 4-ol. It's a phenolic compound that damages the cell membranes of bacteria and fungi, leading to leakage of cellular contents. It also inhibits bacterial respiration. I don't know if it is this class, some students wanted to make lip balms or creams and assisted them. But I didn't ask them what preservation or preservative they would use. Maybe they knew what they were doing. What's the application of this tea tree oil? It can be diluted and used as a surface cleanser for a milder natural origin option. So it's quite widely used. You find tea tree oil in every pharmacy or in most pharmacies though. And the largest producer in Zimbabwe is SM Oil. We assisted establishing this factory in Marondra at SN Oil years ago when I was still at the UZ Department of Pharmacy. And now they have grown very, very big, run by my white friend Tippett. So you can actually buy it from them. It costs you $50 per liter. And the liter is quite a lot because you don't use a lot. Vinegar, acetic acid. Mechanism: acetic acid lowers the pH of the environment, making it too acidic to most organisms to survive. So the undissociated acid molecule can also penetrate the microbial cell and disrupt its internal pH. And once that pH gradient is destroyed across the membrane, it cannot make energy, right? It cannot synthesize ATP, right? That's the mechanism. Application: it is general purpose cleanser for light duty sanitation of surfaces and equipment. You may wonder why vinegar is used in this. The vinegar that you use for your chips is very highly diluted, so you can actually ingest it. Let's look at antiseptics. What are the principles of antiseptics used? Antiseptics are formulated to be gentle enough to use on living tissue. They are used on living tissue. Their main goal is to reduce microbial load without causing significant tissue damage. Their applications here is your cleaning of your hands, treating minor cuts, burns, or wounds, right? You can actually incorporate this in your wound healing products when you make them. You actually accelerate wound healing by preventing external infection on the wound or burns. We have got providone iodine. Providone iodine is similar to betadine, which you can buy in the pharmacies, right? And mechanism of action: iodine is a potent oxidizing agent that rapidly penetrates the cell walls of microorganisms and denatures proteins and other critical microbes. That's how betadine works, as well as this providone iodine, PVP1. How, where is it applied? Pre-operative skin preparations, right? Topical treatment of wounds and skin infections. You know, the doctors in the surgery, you will actually experience this when you do your clinical, while you're in clinical stages. You know, the surface of your patient must be cleaned of microbes. So you use these ones to clean it so that you don't infect or assist the infection when you open up someone. Chlorhexidine, gluconate, is widely used. It is a cationic biguanide. It binds to the negatively charged microbial cells, disrupting them and causing the cell contents to leak. At high concentrations, it causes the cytoplasm to coagulate, leading definitely to cell death. Where do you apply it? Hand sanitizers, in clinical setups, surgical scrubs, and wound irrigation. Now, when you are treating a difficult wound, especially emanating from people that infected or inflicted with diabetes, you actually have to irrigate the wound. And you can use this before you put on your medication and bandages. You irrigate it first with this product, chlorhexidine, or indeed hydrogen peroxide at 2%. is quite effective. We use it in our practice as well. Natural antiseptics, for those who want to remain natural, you can use lavender. And the active ingredients there is linalool or linalool acetate. Mechanism: linalool is a terpene alcohol that disrupts the cell membranes of bacteria and fungi. Application: you dilute in a carrier oil or water, right? For minor cuts and abrasions. So when you have got these oils, you can actually use them to treat minor cuts and wounds. Aloe vera, where the aloe vera at the campus there, or aloe chabodai at the Rotary there, but we are going to grow a lot of aloe vera around the perimeter of the campus, the seedlings at the main campus. So by January, February, there you've got lots of aloe vera on campus, as well as in the many campus, and then the farm in Desmond. Mechanism: it contains compounds like anthraquinones and saponins that have got mild antimicrobial properties. It also promotes wound healing and soothes inflammation. So you can use aloe vera in combination with the vinegar, in combination with the tea tree oil, right, for a wound product. And this can actually heal wounds very, very, very fast without a scar. Remember, aloes have got these properties: aloe vera, aloe excelsa, aloe chabodai, aloe globligema, aloe zebrina. They can actually do this, but you can use them in combination with other natural medications like your oregano that I've talked about, your lavender, your tea tree oil, your acidic acid. Preservatives, we have looked at these preservatives. We are not going to look at them again, right? Now let's look at sanitization as the last topic on this lecture. Sanitization and hygiene principles. What are the principles? They are the foundational practice. These are the foundational practices that reduce the need for aggressive chemical intervention. Remember, this is very, very important. These are fundamental or foundational practices that reduce the need for aggressive chemical intervention. And they are widely used in GMP, good manufacturing practices. That's where they are formally applied: sanitation and hygiene. In sanitation, you maintain a clean environment for preparation of your products. This includes cleaning, which is the physical removal of dirt and organic matter. And I'm sure you practice this daily in places where you're living, in your rooms, in your kitchens, in your halls, if you're living in a hall, or even in the medical school. Like you see these ladies every day in the morning, 7 o'clock, actually 6:37, they start cleaning up. Disinfection, using a disinfectant to reduce microbial load on the surfaces. This is used in sanitation. You also use this disinfectant. Hygiene. Now, you maintain personal cleanliness to prevent contamination. This includes regular and proper hand washing with soap and water or an antiseptic hand rub. Some of you don't wash your bodies. Go 3-4 days. It's not good. In the rural areas, one can go for a month without washing your body at all. This is very bad hygienic practices. And in hospitals, the question on hygiene is very, very, very important, right? Uh, I don't know what to do, with regards to hygiene. Using personal protective equipment like gloves, helmets, and lab coats, right? I'm sure everyone has got a lab coat. It's actually a one way of practicing hygiene norms, right? Gloves, especially you doctors, plastic plus applications. You ensure a clean work workplace before, during, and after processing your raw materials. You must make sure it's clean. You wash your hands by handling different herbs or products to avoid cross-contamination. You properly store your raw materials and finished product to prevent spoilage and pest infection. When you start practicing on your own and you open up a surgery, you have to inform your council, health and profession and allied council, maybe natural medicine entities. They come and inspect your premises, and MCAs, they come and inspect your premises. They will check on your hygienic settings. They check on whether you have your first aid kit and what's in the kit. They check on ablutions, your toilets. Like I'm sure we've got challenges, toilets at the campus there. This is not allowed, right? So it looks like we don't practice proper hygienic norms there at the college. Maybe it's not a fault, it's water that is not available, right? I think we have covered enough information on this. Like I said, I'll send you details of other information on zipped documents so that you can read through this. You must keep these notes when you go for your clinical studies from part 4 onwards. You will actually see this in reality in hospitals, and you must be able to practice or pinpoint in that hospital setup that this thing is not, this place is dirty, this toilet is dirty, patients may contract infections, especially Pseudomonas aeruginosa, which is a very opportunistic microbe. Any questions? If anybody's still there, I can see Theophilus. It is straightforward. Now, what we are going to do is, I'll try and send all this information to you, Theophilus, and the other information of all the lectures that we've done. And I think we've come to an end. We've done the spices and the, have we? Yes, and the bodies. Yeah. So this will be our last lecture. And we are going to have 2 tests. I don't know when you want to have them. Part 3 is said, give us a breather next week. It was after next week. I don't know what you think. Yeah, I think the same. So after next week. So what I advise you now is to read all these. Read these notes. And as I promised, I will send you the other stuff. You read through this. And when I come back, we'll revise again for the final professional exam at the end of the year. Any concerns? Simba? Mashiri. Asikuninzwa. Chikono. Tafad's why I'm saying them. I'm seeing you here.
No questions.
No questions.
Yes.
All right. Mugobe. Ichikarakara. Hello. I'm trying to talk to the technician so that they show you how a an autoclave works. We have got an autoclave in the microbiology lab there, so it should be one of your practicals there. Okay, if there are no questions, we call it a day. And I wish you good luck and your hit. Zinjeke, how are you? Zinjeke and who is this lady here? Apana Zita. Why is Theophilus Zinjeke there? Mashiri. Any concerns? Yeah, okay. Okay, we call it a day. Bye-bye. Bye-bye, bye-bye, bye-bye. Watching this as a next